So just be mindful of your audio, video, your chats in this meeting specifically. And just also so everyone knows, afterwards, I will be working with the comms team to get this video uploaded to YouTube so I can share the link out to everybody and you can share with your teams and folks. So before I pass over to Chatrina, are there any questions before we get started?
Are there any special requests of things that folks would like to see? We did receive some from outreach and training, and the requests were a walkthrough of how an employee or a benefit administrator would look at a subscriber's current enrollment, maybe what the differences are in how a benefits admin will see it versus an employee, to demonstrate changes through special open enrollment events. I think we also had specific requests to look at how we go about adding a disabled dependent as well, and a spouse, changing medical plans for subscriber enrollment in LTD, and being able to do dependent verification. So that was where my intent was today. I just wanted to see if we had additional requests.
Hi, Katrina. This is Jeff. That's a lot of stuff. That's good stuff. If there's any time, I would be super interested in seeing the difference between a medical only look, a group with medical only versus a group that has full benefits.
Okay.
I don't know. We can do that some other time, but I'll just throw that out there.
Yeah.
Thank you.
For sure. Just making a note. Okay.
This is Stacy. Is it possible, if there's time, to see what it would look like to walk through a retiree or continuation coverage from a customer service perspective when processing an enrollment?
I can show the initiation of an enrollment. I would need some support on the other side of that. And I think, does Stacy, you asked the question. Does Amanda have an additional walkthrough set up on that for the in-depth walkthrough on the retiree coverage from HCA's perspective?
Not at this time. We don't have anything additional set up. We did walk through that roughly a month ago, but we don't have anything additional set up currently.
Yeah, that's a whole different workflow. So we might not have an opportunity to get into the nitty gritty on it, but we can definitely use our time to walk through the initial pieces on the employee type coverage. And then, yeah, as we have time, we can start walking down the path of a retiree. Does that work, Stacy?
Sure.
Okay, and then we can also work on setting up some deep dive time to walk through that again, because I know that there were some takeaways from that last conversation and we made some adjustments. So I think it would be good to see how those have gone into effect.
Yeah, that would be great.
All right. Okay, so the dashboard that you're seeing right now is that of HCA administrator. So I'm logged in as somebody with the highest level of access here at HCA. So I can look at every SEB organization, PEB organization. I can make system changes. There are different roles even here at HCA. We can get into some of those details a little bit later on. But some of the functionality for making system level changes would be restricted to just a few roles. So the first thing I wanted to do is go ahead and look at current enrollment. So I'm going to start, I could either go directly to an organization and search for a subscriber from there, or since I already know who the subscriber is, I can actually just start directly from the dashboard and not have to drill down. So in this case, I'm going to go ahead and pick Chris Carter. And this person was entered as newly eligible and then also has overlapping open enrollment period. They need to still make their newly eligible elections. So actually, I'm going to go look at Cassie because I believe the elections have already been made for that subscriber. Yes. Okay. So you can see the difference between the two screens. Now I have the ability, I can continue to make changes for the newly eligible election, or I can proceed to the open enrollment. If I do go through the open enrollment, the newly eligible will no longer be available to make changes to as a subscriber or as a benefits administrator. And that's mostly in part due to the order of operations in which Pay One can store pending enrollments. And it's been a challenge that we've been working through with SubMy account on some of those things. So this is a way to have people make the appropriate elections for newly eligible first and then open enrollment. I see a hand up. Alan.
Regina, since this is going to go live in May, are those dates going to change? Or are these labels going to still be there?
The open enrollment dates that are reflected here are just based off what we input into the system. So it'll, the open enrollment dates will be appropriately reflected based on what we have input for future.
And newly eligible, it says for coverage December 1. So is that going to change?
Yes, this was just
Okay.
because I entered a person on November 1st, or said
Okay.
that they were eligible on November 1st. And so they
Okay.
had an opportunity to pick coverage, or their coverage was effective December 1st because this was Aberdeen School District. So that's also a nuance to keep in mind is if this was a PEB eligible subscriber and I had put them as eligible on 11/1, they would have received coverage on 11/1. But because they're SEB, they receive coverage appropriately the prospective month. Rita.
Okay, just one last thing about that. If they chose the open enrollment for coverage January 1, would they be required? I mean, they still have to do their newly eligible. Do they have to do the newly eligible first?
Yep, exactly. So if I were to go back to that other one, they have not made their elections yet. I can't, you kind of see here.
It grayed out. It
Yeah.
makes them choose. Okay, thank you. I just
So
wanted to make sure.
Forces this, yes, because that had been a problem in SubMy account where people were making open enrollment elections, never making newly eligible. And then for the month of December, for example, they would end up getting a default coverage. And their election wouldn't take place until January. So that was a fix that we put in place.
Perfect, thank you.
Yeah. So one of the questions was, what does it look like for current coverage? So we can go ahead and go to the current coverage tile. This looks very similar to what it does currently in SubMy account and even what we had adopted originally from PebMy account. So here we have the subscriber name, their county of residence. I didn't have an email address listed here. I could put one in. I'm going to uncheck that just to collapse that back. And then it shows that I have the Kaiser Permanente Core 2 plan and Willamette Dental. It shows the coverage for myself and my spouse, and then what my tobacco attestations were. So do have the opportunity to download that statement of insurance. And again, it looks much like it does in SubMy account with the enrollment for both the subscriber and the spouse. Okay. So one of the questions was, how does it look different from a BA versus an employee? Realistically, it's the same. So an employee would see the exact same current coverage that a benefit administrator sees. The only difference is a benefit administrator can also go in if they're under the organization tab that I did not originate from, and I could actually see the subscriber's history on that tab. So I can see who made the change when down to the minute of the day. And I can also see the login history. I think I briefly looked at that the last time I did a demonstration. Would anybody like to see that now? The subscriber history? No takers? Okay. So, oh, go ahead, Carla.
Hi, Katrina. This is Carla. I'm from the clinical team and we manage the disabled dependent program. And I'm wondering if can subscribers look at the managed dependents tab and see how long their disabled dependent is certified for? Because we get a lot of questions from BAs about that, and it'd be nice if either subscribers or BAs could see the certifications.
Amanda, do you know if the certifications are visible?
For benefit admins, I believe they are. I'd have to go log in as a BA or a subscriber to confirm. I can do that while we're actively participating to confirm and let you know, Carla.
Well, let's do this. Let's go ahead and complete a special open enrollment for this subscriber. We can add a disabled dependent and see what that looks like. So let's go ahead. So I'm managing Cassie Carter. I'm going to go to the special open enrollment tab. Oh, I already have one in review. Let's pick somebody else. Well, we can add we'll make elections for Chris and then add a special open enrollment. So I'm going to go ahead and select medical plan, dental plan, vision. And we will definitely go through a formal review on all of this language. I can see a little issue right there. And then I have all of my confirmation language. I can proceed to the tobacco attestation for myself. Not used tobacco in the last 2 months. My legal notice on the tobacco, confirm. And then I have the opportunity here on the long-term disability to either buy down or opt out. In this case, I can opt out. And I have all of the other links for the various additional supplemental benefits. So here I have the summary of coverage elections. I can go to the next step, look at my basic life AD&D. And again, and I might need to just zoom out a little bit. Hopefully you can still see that. But the legal notice is presented to finalize my selections. So again, I can download those elections. And we have the summary. I can go back. And I can go back to the dashboard. In this case, that's exactly what I want to do. And now you can see I have additional information and I can move on to that open enrollment piece. So this one has coverage as of December 1st. I can go ahead and start a special open enrollment. So in this case, you can see we have actually special open enrollment events and other enrollment events and account changes. So I have an opportunity here to differentiate between the two. And this is an opportunity, as we talked about before, to actually be able to put in things such as like death or divorce from a spouse. And here under the special open enrollment event, we're going to go ahead and do a birth or adoption. And we'll say the adoption event was on the 14th. You don't need to override the coverage effective date. Barb, you have a question?
Yeah, Katrina, on the other, select other event or account change, is that one just for annual open enrollment or is that beyond that? Are you going to demonstrate that and I'm too early?
So this one, I have to have a dependent enrolled in order to be able to pick one of these appropriate, and this shouldn't say special open enrollment event twice. It should say other event or account change. We can go through that after I have another dependent on the account, and then we can show what that looks like. And I can actually show you, I initiated that on the Cassie Carter account, so we can look at that.
Okay.
Okay, so I'm going to add the new event, and it puts me right back into the wizard. So do I have dependents to add? I certainly do. and I'm going to pick that they are a child. It initially defaults to dependent not disabled until I've gone through and actually put in the birth date, and then it is intelligent enough to derive that. So put in social. Oh, look at that, I'm putting it in wrong order. That's okay. Carter. So you can see as soon as I put in a birth date that's over the age of 26, it automatically changed my qualifier reason to disabled dependent. And then I select that I have same residential address. I get to add coverage. I want medical, dental, and vision. And I'm going to also say it's an adopted dependent. The adoption date I said was the 15th, I believe. So I get to make a tobacco premium surcharge attestation for the added dependent. I'm going to say no. So I've reviewed my dependent here. I've added them to medical, dental, and vision. No on the tobacco. Spousal surcharge is not applicable. Do I have any additional? I'm going to say no. And so this is my election. So we can review what I've done. I can go back and edit the dependent if that wasn't appropriate, or I can move forward. I have the opportunity to upload a file if I'd like, or I can just proceed to elect coverage. In this case, oh, one thing I wanted to show you. Can I go back and stuff? On the upload screen here, we have this, I guess it's really pink, not red. We have this messaging here that says for a dependent with a disability, only upload dependent verification documents here. The certification of a dependent with disability form should not be uploaded, and to please follow the instructions on the form provided. So I can, as I said, pick a file or proceed to coverage. In this case, I don't really want to change my plan, so I'm going to continue moving forward. My medical, dental, and vision. Again, same confirmation languages. My attestation stays the same for tobacco. So here are the summary of coverage elections.
Katrina, this is Carla. One thing that does cause me concern is I don't want the subscriber to think that their overage dependent is enrolled, because they're not enrolled until their disabled dependent certification is approved. And a couple screens back, it made it look like that they were able to enroll their overage dependent.
So these are all around elections, and I'd have to drill down into the language, Amanda, and I think we can definitely, we will be reviewing that with the business. So I think we will want to just pay special attention to where additional language is put. I know we have under dependents that they have to provide, might even be here. All dependents must be verified when added to an employee's account before they can be enrolled. An employee must submit valid dependent verification to their payroll or benefits office or upload it into my account. I want to change that. So yeah, we can definitely look at the language to see if there are additional spots that we can provide guidance on, ensuring that a dependent, or that there isn't any confusion that they do have to provide that additional documentation before they're actually enrolled.
And
Thank you.
also, when you're actually adding a dependent who is extended or disabled on the actual point of when you're adding them into the system, for those two specific dependent types, we actually populate additional information on the screen before you actually save that dependent, which we don't do for, spouse or, regular child, that tells them the additional information that they need to provide. So that's also another good opportunity where we could provide additional language that makes it even more clear of, you know, hey, they're not actually enrolled until you provide these things. So definitely easy change for us to do with language there.
Okay, and another thing I've noticed as I've been going through this, we have multiple confirmations. I'd love to see if we can consolidate some of these just from a user perspective and have an opportunity to make sure that it's really clear when we get to a point of, are we done or do I need to continue to confirm? I see somebody else has their hand up.
It's me.
Hey, Stella.
I have a question. Like you had in your earlier screening, you said do not upload the certification.
Mm-hmm.
What if somebody uploaded one?
We just delete it.
Oh,
Yeah, we can delete it and it's not then visible, but yeah, it's not supposed to be uploaded because they have to provide it. I think actually Carla could tell us what the process is.
I'm just thinking like someone like will disregard what we put up there and just upload the certification.
It's happened and we have deleted it in the past.
I just don't want them to think that their job is complete because they uploaded it, because they need to send it to their plan. But like you said, we can work through some of those details.
Yeah, there may
in wording.
be some language you can clarify in the screen, or even, I don't know if it's even possible to state like in the upload section, like upload this particular form. And so like the instruction is more clear for the subscriber.
Yeah, absolutely. We're going to be going through the language together with a fine-tooth comb. Amanda Olson is super helpful in that too. So looking forward to getting all of your input on how to make that as clear as possible, especially for that population that we really want to make sure we've got taken care of. Jean, did you have a question? I'm sorry, Stella.
Stella, were you done?
Yes, I'm done. Thank you.
Okay, thanks, Stella.
So my question is related to a few screens back, and it's about email addresses. I just wanted to confirm, we're not mandating that folks have to enter an email address. Is that correct?
Correct, yeah.
Okay. If that was something we wanted to change, would that be a big deal?
No, that would be fairly straightforward.
Okay. Great, thank you.
Yeah, I know there's been a lot of debate on that.
I think clarify that BAs need to have an email address. Subscribers don't. Okay.
Yeah, and I think part of it too is currently we don't send account level information to subscribers, but we do send them program updates and more of the general communications through email. Okay, so we completed the SOE. I kind of fast forwarded through many of those confirmation screens, which will, as we said, need a thorough vetting. So I'm going to go ahead and submit the request. And now I can see I have a birth or adoption pending event waiting for review. As the subscriber, I can cancel the event or I can ask for a copy of the elections PDF. These really should be not grayed out. So we'll be working on that. You can see we've got that kind of consistently where these need to be updated to show that they're actually selectable. So in this case, I can go to the dashboard of Aberdeen School District. And also as HCA, I have the ability to show only PEB or SEB organizations. At this point, if I just really want to minimize things, I can. Otherwise, you can do my search. So there's Aberdeen. So we have, looks like 41 dependent verification requests and special enrollment event verification. So as a benefit administrator, I want to look here. under Chris Carter, where I added that birth or adoption event that's pending. And it gives a nice summary. So the subscriber or the benefit administrator on their behalf added a dependent. They added the dependent to dental, medical, and vision, and did not make any other new elections for this SOE event. If I want to go in and click something else, and if I need to adjust what type of event it was, or if maybe I had the subscriber call me and say, no, I really didn't want them in vision, there's opportunities to go in and change that. Otherwise, I can verify those pieces here. And submit. So the special open enrollment event was updated. When I look back at this screen in the future, I won't have it listed as a pending or a to-do. So if I go to the dependent verification section, I should have Carter. And there we have it, disabled dependent 26 years or older. So because I'm HCA, I have this certification tab here. I can do the verification of the relationship and say, yes, it's verified. Document type is an adoption decree. And I need to pick them back up because they are now verified. But on the HCA dashboard is where I would also see the dependent verification, or not dependent verification, the certification. Carla, you have a question?
Yeah, I may not explain this well and need help from others, but there are some dependents that are extended dependents and also disabled dependents. And we have a few issues in the current system where, say, their disabled dependent certification lasts for 2 years or 5 years, but the extended dependents have to be certified every 12 months. And so we don't have a good area for those things to happen concurrently. So if someone is not recertified as an extended dependent, we would just want to make sure that also ends the fact their disabled dependent certification.
So yes, as a total program decision, the information that we've received to date is an extended dependent does have to be, regardless of, disability status, does need to be re-verified every year. So if, are you saying that there should be maybe a business rule in place that prohibits also certifying beyond the extended dependent point in time, or would you want to re-verify that every year as a disabled dependent? Because I thought it was just the extended dependent.
It's just the extended dependent. It seems like, and I'll defer to others, it seems like we just want to make sure that there's an interaction between the two areas so that if someone is not re-verified as an extended dependent,
they will get terminated. Yeah.
Yes.
Mm-hmm. So we do have that process accounted for, and we'll want to make sure that we include that in the scenarios for testing.
Okay.
Yeah, that would be good. It should work either way, Chatrina. If they're an extended dependent and there's a disabled dependent piece, then those should go hand in hand. If one's canceled, they both should be flagged to cancel.
Yeah, we would terminate their enrollment even if an extended dependent did not get re-verified, it technically wouldn't end their disability verification. It would just end their enrollments as a whole, though, due to the fact that they didn't get re-verified as an extended dependent.
Oh, okay, that makes sense.
Because then if they did provide information, we'd be able to re-enroll them, but otherwise that would then require a whole re-verification of the disability status as well. But we can definitely, walk through that and make sure that it's working well. I haven't seen any issues with that currently. And I feel confident that we do have that accounted for, but we definitely want to exercise that in our UAT. So Amanda, if you can make note, I know we have extended dependent and disabled dependent, but we want to make sure that we put the two of them together in one of the scenarios as well.
Got it.
Thank you. So on the HCA dashboard, so again, I'm kind of going back and forth between being a benefit administrator, seeing some of those views, and as HCA. I would expect here on the dashboard to see the request for the disabled dependent because it did not certify them. So it still says pending certification. So I can go in here and do the certification either from where I was at previously or obviously as HCA. So the certification type in this case, I'm going to say permanent. We'll say the start date is the 5th. Is that working? My date picker. There we go. I don't have an end date. And I can click save. Effective start date must be the 1st of the month. Aha. So that is something. Actually, Carla, I want to ask you that. Is it always the 1st of the month for a certification? Because in this
Yes.
case, as an adopted dependent, I would imagine that it would start the 1st.
It always starts at the 1st of the month because
Okay.
their existing coverage goes through the last day, like of their birthday month, for example.
Okay.
And it's nice if we can. The other day I was trying to certify someone for that their certification would last 5 years, and I had to use the calendar picker thing, and it took forever to get to 2027. So can we type in a date, or do we have to use the calendar chooser?
Yeah, like I just typed in that date. You can type it in as well.
Okay.
Yep. And then the status, as I understand, this is what is displayed. It's viewable by PERS pay, which should be benefit administrators and the subscriber.
That is correct. That is these fields are exactly what you can see when you log in as a subscriber and you view your dependent. I confirmed that while we've been going through this process.
Okay. So we're going to go back and look at it from the subscriber's view. I may still have Chris here. So I can go to the dashboard. I can manage dependents. And here I've got the certification. Oh, I've got Medicare information as well. Manage dependents. There's Carter. I'm not seeing there's the certification information. It's collapsed. Okay. So I think we could improve the way this is displayed up front. But I can see that I have the certification and the certification status. Amanda isn't showing here what I just completed. So we want to make sure that there are some things that we do have some system defects logged for. We're working through making sure we have those all tidied up for UAT. All right. What was the next step? Somebody also wanted to see adding a spouse. So I'm going to go ahead and add and actually we also wanted to see a medical only organization. So what is a current medical only political subdivision? Does anybody know off the top of their head?
I think Whatcom County Library Systems is currently, unless they changed this year.
Asotin or Asotin County also is. That's the one we typically.
Perfect. Thanks, Amanda.
Yep.
Yeah.
It's
All right. So I'm in the Asotin County. And we can see if there's additional. So we do have some subscribers in here. And take a look at. Ooh, are they terminated though? Let's find out. So I'm going to look at their current coverage. They are not yet terminated. So they have coverage UMP Classic starting in January of 2022. And you can see that there is no additional information about dental. And they also do not have the opportunity under supplemental benefits to make additional elections. They don't have supplemental benefits. Actually, don't medical only have smart health access?
Yes, they do. They have access to smart health. They just don't earn incentives.
Okay. So we'll want to update this supplemental benefits section to make sure that they have the ability to go to those other areas. Do they have MetLife as well? Or life insurance? Probably
Medical
not.
only, they do not. They only have the medical and medical related benefits, so medical and vision.
Okay. All right. So in this case, we can go ahead and do a special open enrollment. We don't have one added yet. We can go ahead and add a spouse. So marriage. The event date. It's kind of wonky because it's technically within their their eligibility period, but we're going to go ahead and try this.
Well, you could do a marriage prospectively, right? You could enter it to keep your place in line. So you could do a marriage for the future.
Mm-hmm. Yep. I'm going to go ahead and add a spouse. Married spouse. Date. Partnership start date. I'm going to say is the 15th. Name, address. We're going to add coverage. Since it is medical only, I only get the option to add for medical. And again, we provided this step here to be able to cancel adding a dependent. For whatever reason, so many people added dependents that they didn't actually elect coverage for or miss that step later on. So this has been a big improvement. We can assert for tobacco use. And then I do get a spousal surcharge. And if I pick yes, all the way down, then I get an opportunity to go to the spousal plan calculator and override my final answer to a no, which would then require me to reattest every year. Otherwise, I can move forward and just say, yes, I'm going to pay it. So based on the current attestation, I will have to pay the $50 per month. So I can save and finish. I don't have additional dependents to add. And again, so here's part of where we say you have to provide proof. For each dependent you've added, you have to provide proof of the dependent's eligibility. You can link out to see the qualified dependent verification documents that we accept. And then we have all of the language here that asserts. Yep, it's all the basic confirmation language. So again, I can upload documents if I'd like. I picked a document titled tax return. In this case, because the marriage is so new, it automatically gives me what is available, which is marriage certificate and evidence that the marriage is still valid. We're going to pretend that that is exactly what I provided. It applies to my spouse and for the marriage. So I uploaded my documentation. I can change my medical plan due to my marriage. And then again, more of that confirmation language. I have not used tobacco in the last 2 months. Change that. Confirm and review. Here's a summary of elections to date. Again, another legal notice. I actually have to scroll down in order to be able to confirm that. And then I can submit my special open enrollment request. Laura, you have a question?
Yeah, what happens if the spouse that you're adding is already a current employee with another district in the system? How would that change listing them as your new dependent?
You would be blocked if they have if you basically would end up in a dual enrolled situation by adding a new dependent. That dependent would not be able to be added until the dual enrollment on the other side has been cleaned up. So
as soon
either
as you enter the social security number of somebody who has coverage either already in the same program or in the other program, we provide a message right away that says this person already exists with existing coverage and they cannot be added to this account. I don't know the exact language off the top of my head, but we provide them language as soon as they enter the social security number.
Fantastic. Thank you.
And it is different if you're adding, as an organization, if you're adding a subscriber that is enrolled as a dependent someplace else, it will provide that different warning information, because if that subscriber never goes in and makes elections, then they are going to default into coverage and their dependent enrollments will be terminated so that they don't have overlapping or don't have dual enrollment as well. So it's all based on that fun dual enrollment logic that we mapped out, and that will be exceedingly fun to test when we're in the system.
Thank you.
Okay. So again, on the dashboard as the agency, if I want to go to the special enrollment verification setting, I have here now the marriage. I can view the marriage certificate, or in this case, it was a tax return. And I can say, no, it's not approved. It's denied. And the document type is because I didn't receive this. So I can submit that change. And now if I go back to the dashboard, I will not have, oops. Yeah, it looks like our notifications on pending or approved are not saving. So we'll just want to make sure to get that updated.
My guess is it's a funky refresh issue, but we will take a look.
Yeah. Very likely. So I'm going to go back into Asotin County. No, it's still there. Okay, but we'll go ahead and get that tidied up. And what was next on our list? Medical only. Was there anything else that we needed to see as an employee type subscriber, or would we like to move on to submitting our first retiree form, retiree request form? Okay, so I'm going to go back to actually the subscriber spot. I'm going to pull up one of the Carters here. And so here on the bottom of the page, I do have this widget for continuation or retiree coverage. So I have an opportunity here to read a little bit about the continuation coverage. Even as a subscriber, I can submit a retiree request. So in this case, I only have retiree enrollment available to me because I have not been terminated from my organization. If I was terminated, then I would also have continuation coverage enrollment as an option to submit an application form. But in this case, we're going to go ahead and be able to do the retiree.
Hey, Katrina.
Yeah.
Would they need to have reached the termination date or just have a termination date entered in the system before they would be able to do that other enrollment?
They just have to have the termination date entered in the system.
Okay, thanks.
Yeah. So would you like to opt out of completing? This is only present to me as HCA, but in this case, I'm going to say no, I want to see the form. So we do have a lot of the language that we pulled in from the paper form, and I do know that we would like to try and consolidate some of that, make it more user-friendly instead of being so wordy. So bear with me as we go through this and understand that we are happy to receive lots of feedback on how we can make this more user-friendly. So the first question is really around how the retiree will be paying for benefits, pension deduction, automatic bank withdrawals, personal check or money order, or if they're going to go ahead and request to defer coverage. So in this case, I just picked personal check or money order. There had been a request already for an enhancement to be able to capture this information in the application. At this point in time, it does not. They still must use this electronic debit service agreement in order to have the automatic bank withdrawals done. We do have it logged as an enhancement to be prioritized and discussed for risk and policy perspective. I see a hand up.
I'm sure you can't guess who this is. So if the payment stuff says I will be deferring, shouldn't deferral come first? I really worry about how we do all this stuff, and I understand that you're gonna, open this up for comments and feedback, but just a thought.
I think that is great feedback. Why do I have to read all of this stuff before I can get to the spot where it says I'm opting out? That is good. Good point to make. Okay, so we're going to proceed to the enrollment deferral form. And again, like I said, this is very much like the form that they see online with in a PDF. Some of the information has been carried over. They do have an opportunity to enter their address because that certainly will drive plan availability. They will have an opportunity to update it. In this case, it's pre-populated with what I had entered previously. I can check that again. Am I enrolling, deferring, enrolling after deferring, or separating? I can just say I'm enrolling. And so in that case, it does ask me, do I have Medicare Part A or B? And I don't have Part D. Do I want to enroll in medical, dental, retiree term life insurance? I can say yes, all of the above. I'm not deferring a specific, I'm not deferring medical or enrolling after deferring. So I'm going to go ahead and proceed down. Acknowledge that I've completed the MetLife employee enrollment change form for retiree plans. And then I have an opportunity here to make a tobacco attestation. If you're enrolled in parts A and B, obviously the premium surcharge doesn't apply. Oh, I forgot to check the box. My mailing address is the same as my residential. Stacy.
Is there a spot on this form, or maybe it's further into this, but where they can enter their Medicare number, their HIC number?
It's a good question. I don't think that they can enter the number here, can they, Amanda? No, you can just say whether they're enrolled or not.
Is it asked later in the form somewhere?
No, because that's been, and I don't think we have it on the form currently, so we didn't include it on this. If that's something that we'd want to add in, we can. Otherwise, currently, I believe Alexia and team key that in based off of information received from CMS.
It is
No,
on the
that's
new
not correct.
form.
Yeah.
Yeah, it's on
Oh,
the
it is
new
on the
form.
new form?
Yeah.
Okay. Well, that's good. And what were you saying, Ellen?
I was just going to say that it's on the form and that
Oh, it's on the
being
form.
keyed from there. So,
We'll need to add that then.
yeah, and then all the new information about the optional race, ethnicity, etc., all of that will be included as well.
Yep, Amanda's working on the design of that, and we'll be working with PM&M and outreach and training to vet that.
Okay, great.
To know where it goes and how we're collecting it, what it looks like. Yep. Okay. So I can proceed to the dependent form. In this case, It's nice. It does bring in my existing dependents, and I can provide information on their Medicare eligibility. Oops. And I can uncheck the box. Oh, no. Where's the ability to remove them from coverage? I think it's on the next page. Oh, or maybe that's just not working. So we'll have to adjust that. And then I can say, no, they're still not smoking. And I have the opportunity then to add additional dependents versus the ones that were just currently covered. Continue forward. I can make plan elections. Primera Supplemental Plan F is not available, but I can pick one of these and move forward. Pick a dental plan. And then I have additional information specific to retirees. If you're enrolled in Medicare A and B and you want to enroll dependents, you have to provide valid verification. And then we have some continuous coverage information. So I can either select documents here and upload them. I could upload the Medicare card here as well. I think there's some additional language that we want to put on here around those types of things. And I can continue. I can download what I've selected with a nice little typo. Basically, it's just a copy of the form I submitted, and then I can submit it. I also have the ability to edit this form or delete the form, and then again, request a PDF of what changes I just made. So if I edit, it basically takes me through some of the same steps as it did before. Any additional questions about the subscriber portion of this form?
I have a question for you. So if someone currently has a dependent, which is what you showed on here, and so they're enrolling in retiree coverage, it carries over the dependent information that they currently have. Do they have to take action on that dependent? Do they have to affirm, yes, I want that person to stay enrolled, or no, I don't want them to? What if can they skip over that dependent section? Or do they have to make an affirmative action?
So on this dependent section here, I should have the opportunity to remove the coverage that they currently have. Here it is. So it was maybe did I miss that part? No, I think it presented differently the first time I was in. So we just need to work on this. But yes, I have to. So currently it defaults to whatever current coverage they have existing, and you would have to deselect the box in order to remove that coverage. If we want to do it the other way around, we certainly can.
Okay, thanks.
Stacy.
How are the signatures being captured for the subscriber and spouse or dependents that are enrolled in Medicare?
So that would be so we present them a PDF and they can either print it out and sign it, or they could sign it digitally if they have that, and then provide it in the upload feature.
Okay.
So if they,
Are
especially,
oh,
go ahead.
Go ahead. Oh, this is Leanne. Are the medical plans that they have options to select related to the service area, the residence address that they key in, or do they have all the options?
We present all of the options, and we had talked to Alexi about that as well, around what to present to them and to try and limit the possibilities of them selecting the wrong plan and then having to reselect. So at this point, we did move forward with what the form has. And again, we've gone back and forth on making that more dynamic so that it does reduce the possibility. But at this point, the final check really is on the customer service rep.
Okay, thank you.
Amanda, did you have any other additional info on that particular piece? Because I felt like we really talked about that one a lot.
Just what you said, that what we're doing is, basically an online form and kind of status quo that customer service team will be reviewing those and navigating back and forth with the subscribers if there's changes that need to be made. That was what was determined for in scope for right now, with potential enhancements in the future.
Can I make sure I understand what you guys said? So I live in King County, and if I'm a retiree enrolling, Kaiser Northwest, which is only available down south, would show up as an available plan for me?
It would be present on the form, yeah.
Okay.
At this point in time.
So if I'm a SEB person and I live in King County, Kaiser Northwest is not going to show up for me, correct?
You mean as a SEB employee?
Yes.
Yeah, correct. Yeah. Then it's as an employee, all of the plans are restricted to where you live or work for SEB.
Okay.
And then for PEB, it's based on where you work, or no, sorry, where you live. And HCA certainly can override that and provide a plan that's outside of where they live based on where they work, or continuation of coverage, or special exceptions that are made.
Okay, thanks.
To clarify, that the SEB employee would see the PEB retiree plan. They wouldn't see the SEB employee options.
Yeah, so once this whole form is enrolling as a PEB retiree at that point, regardless of whether they came from SEB or not. Yeah.
Right. I could see the trick here, because when you went through it, they could enter a new address.
Exactly.
And so then we'd have two addresses. We'd have the address they had as an employee and the address they submitted as the retiree. So then that would be tricky as to which address does the system use to display what's available to them.
Yeah. So yeah, that's part of the nuancy pieces of a future enrollment versus current enrollment.
Yeah.
And so we thought it'd be best initially for design to present all of the options as a PEB retiree and have customer service be that checker. But yes, we would like to limit those return phone calls to try and clarify and understand why maybe a plan was picked outside of their existing address.
I have another question. I do just want to do a time check really quick. We only have about 1 minute left of our scheduled time. So just time check.
Yeah, Ashley?
Yeah, I'm not sure if this has been asked before, and I apologize if it has and I missed it, but when a retiree who is not Medicare eligible, is it going to give them an error message if they try to elect to enroll in a Medicare Advantage plan or a supplemental plan?
No, I don't believe so. Actually,
Okay.
I might have to check on that, because we've done a lot of refinements around the retiree piece. So that's a great question. I'll have to get back to you. My initial thought is no, but like I said, there's been some refinements that I might not be completely up to date on.
Perfect. Thank you.
Yeah. Because one of the two would need to be either the dependent or the subscriber would need to be enrolled in Medicare to select one of those plans. All right. Well, thanks everybody for the awesome input. We will schedule a follow-up meeting for the deeper dive on the retiree side. And so Stacy, if you want to give us a list of the must attends for that, then we can work around those calendars. Awesome. All right. Thanks everybody.